everyone. The webinar will begin shortly. All right, let's go ahead and begin. Hello, everyone, and welcome to today's webinar hosted by the National Environmental Health Association. My name is Reem Tariq, and I will be moderating this webinar. Thank you so much for joining us. The title of today's webinar is Environmental Health Within the New Administration and Congress. The election season has wrapped up, and it's time for everyone to focus on the agenda for the new administration and Congress. The webinar, today's webinar, will cover elements of what may be in store for environmental health come January. Please note that this webinar is sponsored by HealthSpace USA. HealthSpace is a leader in environmental health data management solutions. HealthSpace has only 100% web-based solutions for managing all aspects of a department's data with an iPad and Windows app for working offline in the field. HealthSpace will soon release the first and only fully integrated virtual inspection module, allowing agencies to perform certain inspections through video calls if needed throughout the balance of the pandemic. HealthSpace is also proud to have provided the first fully automated contact tracing solution for public health sector, helping agencies deal with the difficult strains put on them in responding to the pandemic. For information or to request a demo, you may contact Cameron Garrison at 980-309-1749 or visit HealthSpace, gethealthspace.com. I apologize, that's gethealthspace.com. A bit of housekeeping first before we begin the webinar. All webinar participants are in listen-only mode. The webinar is being recorded, and the recording of the webinar will be uploaded onto NEHA's website by Monday, December 7th. You may use the chat box to inform the panelists about any concerns with audio or video or any connection issues. And please do use the Q&A box to put in your questions at any point during the webinar, but just know that we will hold all questions until after the presentation. And with that, let's talk about our speaker for today. So our speaker for today's webinar is our very own Doug Farquhar. Doug serves as the Director of Governmental Affairs for the National Environmental Health Association, which is the largest and most influential environmental health professional association in the United States that is dedicated solely to professional environmental public health practice. Prior to joining NEHA, Doug was the Program Director for Environmental Health at the National Conference of State Legislators, where he managed multiple projects and provided policy outreach to the nation's 7,383 state legislatures and their staffs. He received a Juris Doctorate at the University of Denver School of Law and his BA in Government from the University of Texas, Austin. He's currently serving as an adjunct professor at the University College at University of Denver, and he is an affiliate professor at the University of Washington School of Public Health. And with that, let me turn it over to you, Doug. The floor is yours.
Thank you very much, Reem. I appreciate that introduction. As you saw from the very first slide, I've entitled this election season. Election day was almost a month ago, and we still are just getting to the final parts of what this election means, the 2020 election means. And we really won't know who controls the Senate until the Georgia runoff elections occur in January. So we're still in election season. The results of that race in Georgia is going to be extremely important in determining how much leverage the Biden administration will have with the new Congress. Will if it is won by the Democrats, he's going to have a much easier time getting things through than if it remains with under Republican control. Um, but one of the things I just want to kind of reiterate is that the election season over, but the government still continues. We will have a government starting in January 2020 at the state, local, and federal level. We can be assured of that. Um, 5 points I want to kind of bring forward in beginning this webinar. Number one, Joe Biden won. He won the presidency. He received the highest number of votes ever, over 80 million. He is a long established Washington hand. He has a long history in the Senate, so he'll know what he'll need to do to get his agenda passed in the Senate. He is likely to have pretty strong support out of the democratically controlled House. But the interesting thing about this election is he really provided no coattails. House Democrats lost seats. The Senate, the Democrats only gained 2 seats overall, and that's going to really depend on what happens in January, if they gain any more than that. In the governors, Republicans gained seats. In the state legislatures, Republicans gained seats. So all in all, this was a very good year for Republicans in general. And that leads me to point number 2. Republicans didn't exactly lose. President Trump received actually the second highest number of votes ever for a presidential candidate, over 73 million. It really does look like the Senate will remain under Republican control, barring anything that may happen in Georgia that is unexpected. Republicans ended up picking up seats in the House of Representatives, and a majority of the states are being governed by Republicans. These are the people that are going to determine the census in redistricting. Now, following the census, that is going to be coming out this spring. That gives them an enormous amount of authority to determine state legislative seats and state and congressional seats in their states. In addition, it looks like from the census that Florida may pick up a seat or 2, and Texas is probably going to pick up maybe 2, maybe even 3 seats. And it's probably going to come at the expense of some former Democratic strongholds in the upper Midwest and New York. And so it looks like the population is shifting to the South, and that is going to be reflected in the upcoming redistricting after the census. Point 3, same as it ever was. We saw the least amount of turnover in the state legislatures going back all the way to 1944. In like 2016, the pollsters were way off. They had predicted a strong Democratic showing. It was not a strong Democratic showing. There's a whole class of people that generally do not talk to pollsters. And that was very reflective that the systems that they had used in the past that were very effective didn't work when Donald Trump is on the as the lead candidate for the Republicans. Many people that will vote for Trump will not talk to pollsters. Also, like 2018, Americans voted for a divided government. They voted for a Democratic House, but they voted for a Republican Senate. They voted for a Democratic president, but they gave Republicans majorities in majority of the states. Um, this is, as I said before, the least turnover ever seen in state or federal elections going back all the way to 1944. It means we have really turned into one party states for the most part, that the single party controls most activity that occurs in that state, and that the direction of the policy going through that state is all kind of funneled through the legislature, the House, the Senate, and then to the governor to determine how determine the policy. The bottom line, though, is even though we see a lot of unity as a party, we see a lot of disunity within the party. And what I mean by that is that in almost every state, the Speaker of the House does not like the President of the Senate. The Senate President doesn't like the Speaker, and neither one of them like the governor. So there's still inter-party battles that go on to determine which direction the state will go. Point four is that in this election, people voted. More people voted in 2020 than ever before. Part of that had to do with state efforts to encourage voting through trying to give alternatives due to coronavirus. Other aspects is mail-in voting. Many states expanded mail-in voting. Efforts in the past to say, well, you had to have an absolute reason or you had to work with the Secretary of State to get a mail-in ballot. Those provisions were pulled back. It led to stronger voting than we have seen. The average vote rate since 1966 has been 55.7%. For the 2020 election season, it was up to almost 66.9% of eligible voters, even in the midst of the pandemic. Highest percentage of eligible voters since 1900, before the women had the right to vote. Certain states, Colorado, Minnesota, Wisconsin, Washington, Oregon, New Hampshire, and Maine, over 75% of eligible voters voted. Texas broke a record. They saw the highest number ever of eligible voters at 60.3%. Oklahoma was actually the state that had the lowest turnout at 55%. But even then, it shows you on the great number that both parties have to expand their voting base. If on average only 55 or even 66% vote, that means you have over 30% of the electorate who has not voted. And those are the numbers that will be the ones that both parties can turn to expand their base. The final point is the future is diverse. In the past, back in 1996, white voters were up to almost 85% of the electorate. They have dropped to 67%, meaning 33% are minority voters or voters of color. And we're also seeing some other dramatic changes going on. White voters used to make up 94% of the Republican Party. By 2019, it has dropped to 81%. White voters in the Democratic Party has dropped to less than 60%. So the future is really relying on a diverse base and of people from mixed background. And in fact, one of the more interesting things is the fastest growing demographic, according to the census, are mixed race and multiple race communities. Not one single race is going to dominate in the future. 6 states, and another thing is to bring forward is the vast majority of this growth of the electorate since 2000 has come from non-white voters. 76% are non-white, which means the future is really going to be diverse. Now, what is that going to mean for the elections? That is something that is going to be uncertain until it actually occurs. One of the things that that the census has already identified is that we have about 6 states, California, Hawaii, Maryland, New Mexico, Nevada, and Texas, that are considered majority minority. And in these states, for the most part, they're very strong Democratic states, with the exception of Texas. Hawaii, the legislature only has one person in the Senate who's a Republican. So these are states that got strong, uh, great strength within the Democratic Party, meaning kind of reflective of their outreach to people of color. But we're seeing that change somewhat. I think Republicans have realized that this is the future going forward, and they're making efforts to reach out as well. So, and that's one of the things that was noted in the presidency this year in 2020, that there were certain counties in Texas and in Florida that the Republicans did quite well in, and shows that they have a message that can resonate with this group. So where does that put us? Where does that make the electorate in 2020? Well, the bottom line is we're basically evenly divided. 33% of the US identify as Democrats, 29% identify as Republican, 34% identify as independent. Um, in the states, around 52% are Republican, about 47% are Democrats. So it means that neither the Democrats nor the Republicans really have an upper hand. The country is evenly divided, and we are basically engaged in trench warfare. Both sides fighting desperately to get just a few inches, a few additional votes, because it shows if you can get those few additional votes, you are able to redistrict yourself to make an advantage for your party, and that's the reason that we have seen that with redistricting, and also the electoral college providing an advantage to the Republican Party. But for the most part, we're really engaged in evenly in divided country. So where does that put us with environmental health? Well, on a couple points, and one of the things I want to bring forward for this presentation is that neither party owns environmental health. Neither party can say that they are the party of environmental health issues, environmental health concerns. When you deal with it at Congress, the foremost thing that Congress and the federal government can do regarding environmental health is provide funding. And the majority of the activity that you see on environmental health occurs at the state and local levels, and it happens in both red and blue states. PFAS is a very good example where we are seeing contamination of well water in rural areas. Rural areas are predominantly represented by Republicans, but this has forced Republicans to address the problem, to come forward and introduce legislation and introduce responses to dealing with PFAS, because it is affecting their constituency. So environmental health is not a D or an R issue, but we'll see certain policies and certain aspects of environmental health change with the new administration, with the next Congress. With the upcoming Congress starting in January, a couple of things that we have seen in past Congresses will get reiterated. Climate change will be a major issue. We'll probably see bills emerge in the House, as we did before, that may get stalled in the Senate. But climate change has grown over the past few years and continues to be an issue that this country and several countries have struggled to figure out how they will address. Another issue which may gain traction in the next Congress are social determinants of health. What are the issues out there that lead to certain populations to be harmed, be adversely affected, their health adversely affected. Um, these are these basic elements, which are mostly environmental in factors: the water they drink, where they live, the air they breathe, the food they eat. How does that impact their health? Is it adversely affecting their health? Does that mean we need to clean up the water, that we need to clean up the air? How do we clean up these air and water? How do we deal with chemical safety? These are all things that will dictate a health outcome, and is something that is going to be really a very cognizant part of the social determinants of health. And so we could see some language coming out. This is a bill that has been introduced and has some interest in the Senate. It has a great deal of interest in the House, and it's something that if both parties are able to come to an agreement on, it has a real good likelihood of being enacted. What will happen on food safety? Well, the foremost food safety champion in the House, Rosa DeLorio. She was the chair of a subcommittee that oversaw FDA. She is now due to become maybe the chair of appropriations. It's really coming down to her and Debbie Wasserman Schultz out of Florida. Um, uh, it's, there's, I'm not one who likes to predict what's going to happen. But if Delorio does become chair, there's a very good likelihood that this will be very beneficial to seeing efforts being encouraged and being funded at FDA and also at CDC to make sure that food safety is a priority and that these activities that Congress has enacted, like FSMA, are funded and have adequate funding to be implemented in the states. So that could be a major, very formidable, a, very formidable person if Congresswoman DeLorio ends up chairing appropriations. What about the administration? Well, the administration has made it very clear that it is going to make climate change a priority. That means it's going to have the opportunity to sign back on to the climate change accords. The fact that they brought on John Kerry as a special envoy is very indicative of their commitment to climate change. So regardless of what the Congress may do, climate change will be a priority with the new administration. What's that going to mean at EPA? Well, one of the candidates that have been put forward to head EPA is Mary Nichols. And she is the former director of the Southern California Air Resources Board. She was also part of California Air Resources Board, but she has spent basically her entire career in Southern California cleaning the air and being able to go after industries who are not complying with air quality standards, and also encouraging the business sector to adopt more strict air quality safety protocols. So he's been very good at working with industry to get them to adopt air quality standards, which is part of the reason why Southern California air has become so clean. With her candidacy, if she does become someone to head EPA, it can be fairly well guaranteed that a lot of the regulations and a lot of the policies of the Trump administration to pull back on clean air will be repealed, and that we will see a lot more activity going forward to strengthen the Clean Air Act, come up with stronger standards on the for the ambient air quality standards, and see more activity to improve the air. But at this point, we have no decision on whether Mary Nichols will head EPA. There's no decision on who will run FDA, and there's no decision on who will run CDC. And it was very interesting that right after Biden was announced to be the winner of the presidency, there was a lot of speculation that some of his first appointments were going to be for FDA and CDC. And to date, we haven't heard anything yet. So it means he's having the transition team is having a bit of a struggle about which way to go on that. Environmental health concerns. What are we going to see out there? Well, I've already told you the big issues from the federal level: climate change, social determinants of health, appropriations, how much they fund, and chemical safety. And I think chemical safety will be a major issue, seeing the Lautenberg Act actually implemented at EPA. But what does that leave out? Well, it leaves out the food code. It leaves out stormwater, leaves out septic systems, lead hazards, sanitation, retail food safety, state drinking water revolving funds. There are so many aspects of environmental health that just do not get touched at the federal level, that it really is behooves us to really go forward and see, well, who's running the states and how's that's going to move forward. The states are in complete control on whether they are going to adopt the model food code. They are in control about how they want to address lead hazards. EPA, vast majority of EPA programs are delegated to the states, meaning the states can come up with more stringent standards, which is why states like California has been able to come up with more stringent air quality standards than the rest of the nation. Um, uh, so with that, we really need to keep our eye on what is going on in the states. Now, here are a few quotes that I like to highlight for my work with state legislatures. And each one of these is a very good representation about what I've seen in the past from state legislatures. Representative Kim Norton, who is now the mayor of Rochester, Minnesota, she would tell me legislators need precise, accurate information. We have little time to determine problems or devise solutions. And what she was trying to get at is, don't give us a massive tome of information. Give us the points, give us the bullet points, let us move ahead. Mike Fortner, who represents Northern Illinois, he's a professor of chemical engineering at Northern Illinois University. So he understands the science, but he knows the rest of the legislature does not. And they get data, they get tons of data, but nobody knows how to read the data. Nobody knows how to understand what it means. He was very interesting to vote against the Illinois bill to ban lead in toy products. And the reason he voted against it is because the manufacturers, was mostly Chinese and Asian uh, production, they're going to find something worse to put in there. And he goes, they did. They found cadmium, which is even worse for kids than lead is. And so he said we ended up having to introduce a bill to ban cadmium out of toys. He said he would much rather have a situation out there where we have a system where the manufacturers themselves would not put the poisons in the products in the first place. Greg Reed, who is now the majority leader in the Alabama Senate and is going to probably become the Senate president, he was pretty honest with me by saying getting data on how environmental concerns impact public health would be very useful. He kind of like says, I tangentially understand that the environment affects health, but I don't have the specifics. I don't have the specifics which give me the ability to move legislation forward. Now, this is a man who gave me a long discussion about how to adopt and how to enact medical marijuana in the state of Alabama. So he understands that there are certain issues that, even though as conservative he may be against, if it helps his state, he will definitely be in favor of. The final one here comes from a Georgia state representative who was speaking to EPA Assistant Administrator Bob Parasepi, who was Assistant Administrator under the Obama administration, where he would say, please, could you just please read this report I got from Fox News, which means that the state legislatures and state policymakers don't always get the best information. or they get too much data and they don't know how to read through it. They don't know how to understand it. So this is something that I'm really hoping to work with on at NEHA to communicate better data, better information, more precise information for state policymakers to allow them to make good decisions. Environmental health legislation. As I was noted before in Congress, we'll probably see a bill on climate change, probably see a bill on social determinants of health. We will probably not see any bills on food safety. May not see any bills out there on toxics and chemicals, nothing on drinking water, nothing on indoor air. But in the states, we will. Whereas in Congress, I bet you there'll probably be less than 10 to 20 bills that I'll be tracking on environmental health. In the states, I'm probably going to be tracking 2,500 to 3,000 bills. That's where a lot of the activities will occur. And as we saw, what we saw at the end of 2020 was over almost 2,500 bills on environmental health. And that includes almost 1,000 on food safety, close to over 750 on toxics and chemicals. Drinking water was over 400. Indoor air was over 200. Wastewater almost had 270. Of these bills, over 10% were enacted, which is really a good majority, which means that the bills that were introduced, this means across the nation in both red and blue states, that for the most part, these bills were adopted, which means the policies were acceptable to both sides, to both parties, and were something that they said our state needs to adopt this to move ourselves forward. A couple things. The first issue I'm going to talk about is marijuana. And as one astute political commenter said, marijuana is the gateway ballot measure. It's not the gateway drug anymore. It's a ballot measure because it's been at the ballot where we've seen so much activity occur. South Dakota this year not only passed recreational marijuana or medical marijuana, they also passed recreational marijuana. In the past, well, as of today, before this measure passed, they had no laws on the books which allowed for legal marijuana. So we can take a look here to see how dramatically the map has changed since 2008. And mind you, in 2008, medical or marijuana was illegal across the country. Technically, it still is. It's still considered a Schedule 1 drug, but the states have moved forward. And not only are they allowing for medical marijuana to pass, but they also are allowing for recreational marijuana to pass. Right now, we are down to the point where only Nebraska, Kansas, and Idaho are the only 3 states where no form of legalized marijuana is allowed. And if you look at it, the entire South, the entire Midwest, even in New England, even in North and South Dakota now, we are seeing marijuana being legalized. So it shows you how dramatically an issue can move forward when the people get the opportunity to vote on it. The reason I highlight that for this crowd is that marijuana is an environmental health issue. People do not smoke it, they eat it. And that's going to mean for everybody who's involved in the environmental health world is going to be dealing with foods that are going to be laced with marijuana in some manner. And this is something that they're going to have to start dealing with. And it's been a very rough road for most jurisdictions that have adopted this to come up with standards because they can't rely on the federal government to come up with standards for them. COVID-19, that's been obviously the issue of the year. 35 bills were enacted. Oh, I'm sorry, were introduced across the country, and 17 have been enacted. And as you can tell, that's a very high enactment rate. 50% enactment is extraordinary by any means. For the most part, these bills are looking at funding. They're looking at liability relief, meaning a bill down in Louisiana said that you can't sue a restaurant owner over COVID or their COVID-19 activities. But probably the foremost issue is how much authority does a governor have to address the pandemic? Every state has adopted emergency management procedures. So when an emergency is called, the governor has certain authorities, but those authorities are being tested like never before. We've seen actions in Michigan. We've seen activities in Colorado. We have seen activities in many states that are questioning how much authority shall the governor have. As I mentioned before, these are all one-party states. We're seeing challenges against the Alabama governor, which is a pure red uh, legislature. We are seeing challenges against the governor in Colorado, even though the legislature is controlled by the Democrats. So even though we got unity of party, we're still having challenges between the legislature and the governor as to how much authority they may have. To date, we've seen 38 executive orders in 23 states regarding the pandemic. Executive orders are obviously much easier for a governor to sign because they do not have to work with the legislature. But this is something that they're having to do to try to figure out ways to limit the extent of the disease and to figure out how to move their state forward. Um, a couple of things that we are seeing from the state legislatures and from the states on COVID-19 is, when do we reopen? What do we consider safe? Is it 5% infection rate? Is it 50% infection rate, as we've seen South Dakota and Wyoming? Wyoming was just recorded at a 77% infection rate. It is, it's very difficult to determine when do we consider a place safe. Another question legislature is how do we live with coronavirus? Yes, we're getting a vaccine, but it's not going to magically disappear. It's something we're going to have to live with. What are the policies and procedures we're going to have to put in place to make sure that the disease does not spread, that public areas can remain open, that we can begin to go to restaurants and go to sporting events again? What's the metric? How do we determine when do we go back? When do we turn the corner? What do we do? These are, basic questions that there's no consensus on. And the bottom line is, when will an intervention occur that we get to the point where we can be normal again? My comment is, we'll never be normal again. We're always going to have this disease out here. People are going to be much more concerned on respiratory illness, and people are going to be much more interested in making sure that they social distance, and they are probably going to be more reluctant to travel and to be into crowded places. So we've got a new paradigm moving forward. Other legislative issues, PFAS. Again, this is something where the federal government has not acted. They have looked at issues, they've discussed it, but they have not come up with any answers. Because of that, we have seen states starting to move forward. 108 bills were introduced in 2020 regarding PFAS. Of those 108 bills, 30 of the bills were enacted in 15 states. These bills were wide ranging, meaning some were directing the Department of Health to take actions. Others were asking for their universities to start coming up with standards. Other states came up with standards themselves, and that's what occurred in New Hampshire, where the state legislature determined what the standard shall be for any PFAS-related chemicals out there. That ended up being challenged by 3M because they said the legislature does not understand what they're coming up with, and their standard of 20 parts per trillion was not based on science. In turn, Michigan allowed their Department of Health to come up with a scientifically based standard, which actually was more stringent than New Hampshire. 3M did not sue Michigan because it was a science-based standard and they had nothing to stand on. States are moving aggressively in these areas, mostly because the federal government has not taken action. And as I said, when a constituent has an environmental health problem, it becomes the problem of the policymaker. Toxics and chemicals legislation. Uh, Again, it's another issue we've seen a lot of activity on. 118 bills enacted as of September. The most common issue was PFAS, but lead hazards had a lot of activity this year. The foremost issue was testing of lead hazards in schools. Um, we also saw a lot of activity regarding just chemical safety, microplastics in the environment. New York and Washington enacted bills to deal with toxic chemicals in children's products and in the environment. Um, Another one that I found really interesting was New Mexico. New Mexico enacted the Environmental Health Fund, House Bill 312. This bill collects fees from the on-site liquid waste systems and water recreation facilities to fund state programs that deal with on-site wastewater systems, water recreation, food establishments, and regulation of hemp. So that has been a very far-reaching bill to make sure that environmental health remains sustainable in the state of New Mexico. Drinking water. Drinking water is a very important issue, obviously, and we've seen 196 bills introduced in 2020. Again, primary activity, primary oversight and regulation of drinking water occurs at the states. The federal government, particularly EPA, provide funding and guidance on this. And of course, the EPA comes up with the safe drinking water standards, which are applicable for all public water supplies. But it also means that if it's a private water supply, which is anything under 20 or 15 connections, is not regulated by the federal government, which means it's in the purview of the state and local governments. That leaves a lot of opportunity for regulatory activity, and we've seen quite a bit of activity regarding this. One of the foremost things we saw out there this year had to do with lead hazards and a lot of activity regarding regulation of lead service lines and lead in schools and lead and water in schools. Another interesting issue was fluoridation. We saw 5 bills out there dealing with fluoridation, going from Mississippi introducing legislation to say prohibiting the state from determining whether a local public water system shall include fluoridation, to Massachusetts adopting or introducing legislation that talks about supporting the use of fluoridation. None of these bills were enacted, but it was interesting that in this day and age, fluoridation is still a controversial issue among state policymakers. One bill I found really interesting that I'd like to highlight was New Hampshire House Bill 1274. This is a bill, even though it failed, it was introduced, and I think it's going to get reintroduced again, but it required for private bottled water to follow the same standards as public drinking water systems. I found that very interesting, very novel approach that we saw come out of New Hampshire. Many other fascinating things we saw in the states this year regarding food safety, regarding drinking water, regarding chemical hazards, which I did not highlight. The foremost thing I want to bring out is that states are moving forward on many of these issues that previously the federal government had complete jurisdiction over. Regarding chemical safety, really, it wasn't until about 15 to 20 years ago that the states began to deal with regulation of chemical safety. Prior to that, it's completely within the purview of the federal government. Food safety, as we are noting, even with the nationalization and the globalization of the food system, it's really up to the states to determine and the locals to determine what food safety policies will be adopted and will be moving forward with. which leads to a lot of inconsistencies out there, which I know drives the national food system, uh, food um, produce food production systems crazy because they have to follow rules in both states like Rhode Island and California and Texas, as well as Illinois. So it leads to a lot of confusing results out there. Um, so even with the national approach that we do see on environmental health, vast majority of the activity will occur and have been occurring at the state level. I see this continuing. We're going to see bills to address environmental health at both in red and blue states. We're going to be seeing concerns come out and be reflective in many states and as the policies that are moved forward. And in many states where you hear a bill move forward or get introduced, even if it fails, we can pretty much assume if you see it again, there's some interest to make sure you get it enacted. Cottage foods is a very good example. When it first appeared in Wyoming, it it probably started 12 years ago. It took several reiterations before the legislature finally passed it. But once they passed it, they expanded it greatly from that point. So it took a long time for the legislature to enact laws. What do we expect in the future? Well, one thing I think that's going to be predominant in the 2021 legislative sessions is COVID is going to remain at the forefront. Efforts to curb the virus while keeping the economy going it's going to require the environmental health profession to ensure that food processing, delivery, retail remains safe, that the retail businesses provide a safe in-store experience, and that schools are able to protect students, teachers, and staff from the virus and contain any spreading. So the environmental health community is going to be on the front line to reopening the government. One of the bills we did see enacted this year in California requires that Uber and DoorDash and all the food delivery systems that they ensure that the delivery system is clean and does not spread COVID. So that bill has already been enacted in California, and we could see that bill pop up in other places around the country. Um, Reopening of the US economy will not occur until the environmental health community has the funding, resources, and political support to allow them to perform their job. The effort we've seen over the past 6 months to come after the environmental health community, to come after the public health community, has done nothing but harm the reopening of the country. The sooner we get policymakers to start embracing the activities that the environmental health community provides to allow industries, businesses, schools, institutions to reopen, the faster we are going to be able to reopen, the faster we're going to be able to get the economy moving again. This is something that's going to be at the forefront of all the legislative agendas. We are seeing special sessions already occurring, trying to figure out how to get the economy going, how to allow people to survive, businesses to survive the COVID downturn, and it's going to end up having a great impact on the environmental health community and environmental health policies. With that, I'm going to turn it back over to Reem to see if there's any questions we may have from the audience.
Thank you, Doug. That was a fantastic overview of what is to unfold for environmental health within the new administration and Congress. So at this point, like Doug mentioned, we'll move into the Q&A portion of the webinar. If you have a question, please feel free to type it now into the Q&A box. So I've already received a few questions, and we'll do our best to answer some of them in the time that's remaining. So the first question, Doug, is what major changes can we expect from federal agencies like EPA and CDC come January?
I think there's going to be a major emphasis on public health. And what I mean by that is funding for these agencies is going to increase. There'll be less barriers placed on the agencies to to releasing these funds and getting them to the states, with the bottom line of trying to promote public health to make sure the country, the communities, everyone is safe to go back to work, to go back to eating out, to go back to schools. I'm seeing that as kind of the modus operandi. One rumor I put out, I'll call it a rumor, but one rumor I have heard is that the CDC budget may double in the next administration to address specifically COVID issues, which would be mind blowing if it actually occurs.
Great, thank you. So Vince asks the question, given that the states need to balance their budgets each year, what impact do you see on environmental health issues and environmental health personnel over the next years?
I think we're going to start seeing what we saw in New Mexico, which is fee based. And several agencies across the country, and I'm not only talking New Mexico, I'm talking New York, I'm talking Illinois, I'm even talking South Dakota, that if they have a fee-based structure, that allows them to operate without interference from the legislature. When you have to get an appropriation, that's always a much bigger challenge to convince the legislature of their limited resources. How do we do this? They have to balance a budget. They don't have to balance the fee-based system. So now, will that mean that things like restaurant inspections, activities for um, retail food inspections, efforts like that, will those fees increase? They could. That could absolutely see. But I think the New Mexico law was really very innovative about going out to every one of these groups that needs to get regulated and having them fund the regulatory activity. We have seen jurisdictions out there, and what I mean by jurisdictions, I mean public health districts and counties where they have completely eliminated the environmental health program, and the outcry from the community is such that they've been forced to go back. The business community will come to them and saying, regulate us, provide a fee, do whatever you have to, but we need the governmental oversight to make sure we are performing, we can run our business safely.
Great. So Taryn has asked the question, it was said early on that the recent election would be a referendum on the current administration's handling of COVID 19. But the mixed results of the election seem to suggest that America is actually very divided on how the crisis should be managed by the government. Does this result have implications in terms of the American public's view of public health overall? Does it provide any insights on how those in the field might better inform the public about public and environmental health initiatives?
That's a very good question, very long question. The I think at the federal level, the Trump administration did bear the brunt of the public's dislike of the response to COVID-19. President during the outbreak, and so he has to he ends up bearing the responsibility. But we didn't see that play down to governors. We didn't see that play down to state legislatures or even to Congress, for that matter. It's very going to be kind of tough to say how this will play out. But one thing we have seen is that when you have an environmental health crisis or a public health crisis, you end up with a situation where that policymakers realize that this can really be the end of their administration. This is something that we have seen when we saw the outbreaks in Milwaukee in the water system, when we saw it in Toledo in the water systems, Charleston, all sorts of outbreaks that occur are very devastating to the people in charge. And what I usually mean is the governor, not so much the county commissioner or the state legislature. It's usually the governor or the president that gets blamed. And that gets reflected. Which is the reason why some of us are thinking that CDC and EPA are going to do very well in the next round of appropriations, because they're going to realize we need to build up these resources to make sure that the COVID-19 stays at a minimum, that we don't have to shut down the economy, that we can able to limit the problem, the hazards, and we can contain the spread of this without having to shut down the economy, because that's just a very easy way to lose your seat.
Great. Eric asks the question: our air quality measurement infrastructure is woefully inadequate to inform public health. Do you expect any developments in this domain?
In air quality, yes, I do think so, and it's going to be back to climate change. And I do think that the air quality standards are going to be ratcheted up. Well, more stringent, become more stringent. Um, One of the things I kind of saw with the Obama administration, even as progressive as people said it wouldn't do anything unless the auto industry said it was okay. And if you're seeing the changes that have occurred in the auto industry, and especially for the American auto industry, uh, they're able to handle tougher CAFE standards, which means if the federal government adopts tougher CAFE standards, they end up being in a better place to sell their cars. Volkswagen is in a much worse place to sell their cars if we strengthen the CAFE standards. So I think we're going to be seeing those activities. The relaxation of certain air standards under the last administration, it was very helpful to certain industries out there that weren't as clean as many American industries. Um, so it didn't really benefit U.S. companies, whereas I saw it under the Obama administration. It seemed like the bottom line regulation always tended to reflect what the American business industry was doing anyway. So it wasn't a radical push one way forward. I'm, I believe Biden's going to do the same thing. He is personally not a radical by any means. He's very moderate. He is very low key, and I doubt he's going to make any recommendations to air quality standards or anything without some comfort or some ac- acquiescence from the business sector.
Great. Our next question is from Dr. Dijak. Is training available to assist the EH community in how to work effectively with local legislators?
Is training available?
Mhm.
Um, uh, well, I'll be, there are obviously people out there that work with local legislators. There are there are going to be activities done by NEHA in the future to help people interact. There are many resources out there. Uh, I think I'm going to switch the question around to should environmental health be at the table? And of course, my answer is yes. If you're not at the table, you're on the menu, and you very much have to be in front of your policymaking community, because other groups are. I think cottage foods is a very good example of a situation where the business community, the regulated community did get in front of their legislature and said, we do not need to be regulated by our local EH director. And the legislature, that's all they heard. So they said, yeah, of course you don't need to be regulated. And I've had legislators turn to me and say, what do you think about this? I'm calling my Department of Health. They will not call me back on this. Right now, the only thing I have is that cottage foods are a good thing, and we really should repeal and pull back on all these food safety oversight regulations because they're doing no good. Well, that's because the environmental health community never got in front of them, and that's a direction I think we, all of us, really need to work hard to change, to really make sure we get in front of the policymakers and to make sure the environmental health message is given to the policymakers so they can make the right decisions.
Great. We'll take one last question and then we'll wrap things up. The last question is by Larry. The question goes, how is NEHA going to assist the states when faced with legislation that negatively impacts environmental health and increases the risks to the public in the name of commerce or free enterprise?
Um, One of the goals that we have at NEHA is to track what's going on in the states. And if there's an issue that we can provide comment on, we're going to. What I mean by that is we won't directly go forward and testify. We don't have those kind of resources, but we do have policies in place that discuss certain issues that we're going to be able to get in front of the legislatures. One of the probably one of a better example it will be on body art. You know, our body art policy talks about the hazards of it, that what the research says, and it provides an educated overview. When a bill comes up before it goes to a committee, the goal of NEHA is to work with their state affiliate, but to get the policy read into the to the transcripts of the committee. So every legislator, they will all get a committee book regarding this bill. They'll be able to see what NEHA says on this. We won't, probably very unlikely, take a pro or anti stance. We will rather provide the information. And environmental health is all based on scientific data. We don't need to resort to emotional reasonings. We got the data on our side. So there's no reason why NEHA should not be able to present and provide information to the state policymaking community regarding these issues of interest to environmental health profession.
Great. Thank you, Doug. And with that, our time is up. I would like to thank Doug for his informative presentation and answering all the questions. Thank you to all the attendees for taking the time to join us. We hope you found value in this webinar. Just to remind you, Doug's contact information is listed in the chat box in case you are wondering, also on the screen as well. And thank you again for joining us, and